Okay, Commissioners, we are back and we have our last presentation for our budget from the Health Alliance. You're right. Thank you for letting us know. This will be on record for the best presentation. So thank you. Dr. Pilkington, if you will introduce who you have with you, and we'll let you proceed.
Be glad to. I have with me on my right, immediate right, our Finance Officer, Ms. Tammy Harkey, and our Chairman of our Board, Mr. Tom Kincaid.
Good evening.
And I will interject that from our board, Commissioner White is our representative on the Health Alliance Board.
Mr. Kincaid, would you like to begin by saying a few words?
All I'd like to say is good evening. Thank you for the opportunity to be here. I'm relatively new to the board. I was elected chairman last fall, so this is my first year. I'm learning. This is my first experience of being with y'all here tonight, so this is a great learning experience for me. So if you have any technical questions, go this way. Thank y'all.
Keep working. Yes,
Pass
keep
it right
passing
on
down.
back.
I want to first of all start by thanking you for the opportunity to be here this evening to explain our 2013-2014 budget request. I had heard the chairperson say several times to explain what you're doing as an entity, so I'll begin a little bit by talking about who we are so that those folks who are tuning in to watch this know what the health department is. The Cabarrus Health Alliance is the county health department for Cabarrus County, even though we're not a part of county government. The county contracts with us to provide public health services. Approximately 30% of our overall budget is provided by the county, and that's on a year basis. About 30% of the total budget we have is county contribution. In 1997, we separated from county government, and at that time, the county established a per capita funding mechanism that they funded us with. And since Mr. Morris has already gone, the rest of you understand that. You've been here before, so you know that process. About 3 years ago, that process started changing. We weren't really quite sure how much it changed until we got our contract this month. So it's changed quite a bit, but we have a specified designated contract for services that you fund us now as opposed to a per capita. And the county actually selects what it will fund and what it will not fund from the health department services. In the past, we were able to take the per capita and fund what our board decided was the priorities for public health in the community. Just like to blow our own horn a little bit, first of all, and point out that over the last 16 years that we have saved the county over $10 million by being the Cabarrus Health Alliance. That's just in salaries increases you haven't paid, health insurance increases you haven't paid, 401k costs you haven't paid. Just in 401k alone that your county employees get that we don't get, it's $5.7 million over 16 years. So a lot of money has been saved by the creation of the Cabarrus Health Alliance, and it was a good business decision on your part to create the Health Alliance. It's worked well, and it's saved you money, and we still have been able to provide the services we provided. And it also capped your costs for public health expenses. For the last 16 years, you've really had very insignificant increase in comparison with what any other county would have seen anywhere. Over the last 3 years, as I said, you went to a designated fund, and that fund is designated for school health, which is not a required service, and then for the legally required services of environmental health, communicable diseases, and vital records, and some administrative costs are covered by the county contribution. I would point out that over the last 100 years that the health department has existed, it has always had excellent support from the Board of County Commissioners. And because that, we have been able to build one of the best health departments in the nation. And we don't just say that. We were just last month recognized as one of only 9 health departments in the entire United States to be nationally accredited. So when nobody in the Southeast is nationally accredited, nobody in North Carolina is, but Cabarrus is. So that's something you can look at with pride. In addition, we are generally one of the healthiest counties in the entire state and in the entire nation. That number is slipping. We went from being 6th 3 years ago to being 10th this year. I fully expect that number is going to continue to decline, and I think that one of the reasons it will decline is because there has been a loss in public health funding and support over the years. This coming fiscal year, you've probably seen the article in the newspaper from our board meeting. We will be cutting back our clinical services because we no longer have any support for those services from the county. That will put 300 women with needing prenatal care out into the community to get those services. 1,500 children who previously got care through us will be getting their care hopefully somewhere else. We're trying to work that system out. We're concerned about that because we live in a country that has the 22nd worst infant mortality rate in the entire world, and we haven't had that problem in Cabarrus County. We have an excellent record, and we don't have babies who die early before their first birthday in Cabarrus County generally. I'm concerned that we're putting 300 women out there without appropriate care, but that is what has to be done because we don't have the money to do anything else. At the same time that you're funding these services that you're funding, you're not funding those adequately. School health is one of your designated services. We don't even fund school nurses enough to work a complete school day. Most of the school nurses work over on their own time, on their own expense, basically, so they can see the children they have to see every day because we can't fund them for a full school day. In addition to that, we can't provide them health insurance. So we lose about roughly 20% any school year. Their family conditions change or something, and suddenly they need health insurance, so they have to leave. So we have a school nursing program, but it's a very patchwork job at the best. In communicable diseases, we don't afford the adequate staff or cannot afford the adequate staff we have to deal with communicable diseases outbreaks that we might have in this community. Years ago, some of you remember we're dealing with a hepatitis A outbreak when we had to inoculate 1,500 people. I think you were one of them, Madam Chair, in about 70 some hours. It's probably a violation of HIPAA on my part. But
Yes, it is.
but we were able to do that because we had adequate clinical staff at that time we could call on to do that. We're losing the clinical staff because those nurses are called upon to do things like this. Just to give you an example, in the event of a smallpox outbreak, which is not as inconceivable as you might think, we have 72 hours to vaccinate 150,000 people, or 50% of you die. We don't have the people to do that, and we won't have the people to do that. The results could be catastrophic for this county, and not only in a major thing like a smallpox outbreak, but in something minor like a large hepatitis A outbreak. In environmental health, we're supposed to inspect every restaurant every year, a required number of times. The restaurants have quadrupled over the last 20 years in Cabarrus County. I don't think I have to tell any of you that. You've been to Concord Mills. You've seen what's happened out there. We can't inspect the restaurants 100% of the time. We haven't been able to for the last 3 years. The numbers are going to keep going down and dwindling to the point where we're probably inspecting them 50% of the time that we should be. And that's, again, a problem of the funding and the inability to do that. We haven't added an inspector in environmental health in 20 years. So just think about the growth that's occurred in the county during that time. Look at building inspection or somewhere else and add that compared to no inspectors at all being added in environmental health. So I would just say to you in the final summary of this, and I thought about this a lot, 32 years as your public health director, I've never felt as the lacking the confidence that I do at this point that we can protect the public health of the people of this community. In fact, I'm sure that we cannot protect it as adequately as we should. If your priority continues to be to fund school health and only legally mandated services, then you ought to fund those at a bare minimum and not the way we're being funded now. We're not getting adequate funding to run even those services, so you at least should fund those services. And if you cannot see the wisdom and the reason to serve the medical needs of our indigent in the community, through what we have had as a very successful public health safety net for the community, we will and we are going to continue to decline as one of the healthiest communities in the state. I want to thank you for your time again and your consideration. Mrs. Tammy Harkey, our finance officer, will now summarize our budget requests for those specific school health, vital records, environmental health, communicable disease, and administrative support services that you have designated that is the only place that the county money can go, so that's the only services we'll talk about. So.
The information that's on the board up there, I'll talk about that. What it represents is that we currently, for fiscal year 13, the county is contributing to the Alliance $5,249,177. We've asked for an increase of $873,010. And then I broke it down by department where those the request increase are. So I'll touch on each one of those and the main changes there and what that represents. The additional $60,426 that we've asked for in the Environmental Health Department, as Fred mentioned, we need an additional sanitarian. We had one that retired 2 years ago and did not fill the position. We have had a work study done, and it shows that we are behind by 3 positions, so we're only asking for 1. So that will cover the new position and the equipment that's necessary for that position. In the Information Technology Department, we've asked for an additional $19,147. That is for some, mostly for staffing. Current funding that we had for one of the positions, it was part of the Beacon funds that we had received, and those will expire the end of September. And so with that lack of funding and the need for the position, that's why we came to the county for the additional funds on that. You can make a comment about that? Okay.
No.
Okay. General administration, there's a $223,064 increase. Those cover basic needs as far as increases in auditor, legal, occupational health, drug screening, background investigations. Some of these requirements that we're having to do to check for new employees. Before you put a nurse in the school with all those children, you need to do proper background checking. So some of the additional expenses related to that is in that request. We actually had a 1.2% decrease in our health insurance premiums. To put that out there, so there's they help to decrease some of our cost. Our other post-employment benefits, we have 49 current employees on the list for potential retirement for paid insurance after they retire. It's peaking. We discontinued that benefit in 2004, but the 49 people that still remain on that list that will receive that benefit, it's peaking. One day it's going to go down, but right now it's peaking, so that's going to be an additional $18,000 for next year. The utilities have increased about $95,000. I had hoped last year when I did estimations on what the utilities would cost in this new building that tripled in size from where we were, did not take into account enough. The electricity for that building is astronomical. We didn't have an elevator in the prior building, and there's more lighting, et cetera. So the costs there are much more than what I had anticipated. We contract with the county to provide us our HR and finance software. Thank you, Ann. And that's going up $29,000. Our unemployment insurance, we had a pretty huge increase this past year. Still not quite sure how the changes that are coming down on how to pay the unemployment, how that's going to impact us. So we're budgeting for what we have spent this current year. And then we have a average 3.5% performance increase for a 7-month period for our employees, and that represents about $25,000. So total for the general administration is going up about $495,000, but we utilize what we are have budgeted from our dental health net proceeds, and so then the reduction of the $495 down to $223 is what we have requested for funding from the county for that particular department. Next, I'll talk about school health. What I have listed there is $571,861. There was a request to increase the school health nurses. They currently work 6.5 hours a day, 196 days. They are wanting to increase to the 205-day school year and 7.5 hours. We've asked to include group health insurance. This board has also asked us to consider providing that for the employees. We're going to provide a 50% premium. We'll pay 50% and have asked the nurses to pay 50%. Although there's 42 positions, we have currently an interest from 8 that plan to take it. So This number will, this is the revised number to include the 8 positions plus 2 in case two that come in as new to replace vacancies. If they request it, then there would be funds there to cover that. That's pretty much in that line item there. Oh, and there was a lead nurse, a new lead nurse. We had the director retired 3 years ago, and we did not fill that position. We have 2 managers who manage all 42 positions, and they've asked for a lead nurse, and so the cost will include that as well. Next, we'll talk about the Health Initiatives Program. We're not asking for an increase there. That is the work that is related to the community health assessment that is done on every 4 years. It's required by the state. You ask, what do they do the other 3 years? Well, they go through the process, work with all the community leaders to make sure the plans are put in place to address those needs throughout the community. And any increases in that area are covered by other grants that we seek, private grants that we write for, or any state funding that we can get to help cover those increases. So no additional increase there. We currently receive and are allocated $50,000 from the county to help us pay for that. Let's see, takes us down to vital records. Slight increase there, not quite $3,000. That would cover the just the increase in fringe for that position. And then we had a slight decrease in communicable disease. We had a position to go from full-time to part-time, and because and it's less than the required hours or the 30 hours where we pay the group health insurance because of the decrease. And we have international travel, which is a service that we provide for folks either in our county or outside the county that can come. We make enough proceeds off of that program. We were able to decrease what we're requesting for the county to cover those services as well. So that's kind of quick, but that's the major changes related to the funding that you already give us, and for the total to come to $873,010. For a new request for 14 to be $6,122,187.
Commissioners, what questions do you have?
It may be good for Ann to go through and go through what we have got in the budget, because a lot of what they've just mentioned we've addressed. So
What's the bottom line number difference?
I'm not sure what that is, but
Well,
I'd like to know the details on. I didn't know if you had questions first before we. Which areas? I know we talked about school nurses last night, so I know that's one area. But
185, 492 or something along those lines. What's in the current numbers you have is the increase in number of days for those school nurses for 9 days, the increase in the health insurance for 10 people, the environmental health supervisor, and the nursing supervisor. Have I missed anything else? Those are the slides.
and we picked up additional funding that they could no longer afford for the social worker. That was on site. You cut half of you were no longer able to fund half of that salary. That was at your location, and we are funding that.
So is that position to remain at our office? She's not currently on our payroll.
Yeah, but I understand you paid half of it.
We did, that is
Okay,
correct.
and you could no longer do that, so we are picking that up.
Okay.
Discussions as where she will be located can be had. So if it's still
Okay.
advantageous for both to be there, then yes, she can be there.
Very much so, thank you.
Were you paying 50% this fiscal year we're in now? Or
Yes, we were using funds that we generated or had hoped to generate through our clinical services department. That's where
Right.
she was needed.
Okay.
And since we're cutting those services and the
Right.
funding that we're getting from Medicaid has been cut in half,
Right.
We no longer have the funds to support that position.
So what was the dollar figure and the difference between their
The
proposed and
difference
what?
between their proposal and what's in there for us is,
We got 613,174.
That's exactly right.
That's
But once we
exactly right.
reinstate that nurse, it'll be about $555,000.
Reinstate which nurse?
Yeah. what
Not
nurse?
nurse,
Social
social
worker.
worker.
Oh.
Excuse me, social worker.
Okay, but that's on our books, that's not on theirs.
so what he asked
It's
for.
less funding that they're
what it
having.
is the 613,174, and then the the nurse,
Social.
the social worker, that it was a half deal.
Right.
That's still to be determined, but that would be on top of that.
No, the funding won't go to them. We will absorb it through DSS or Human Services.
Okay. How much are we, of their request, because I'm going back and forth, I want to know not the difference of what they've asked for, how much more money are we proposing to fund their budget
Over last year.
over last year? How much more are we funding?
59,836.
$259,836. Okay. I just want to make sure I knew the number, because we were going 500,000, and I thought, wait a minute, is that
Well, no, that's
difference.
what they requested today is an additional.
to that? Right. That's fine. I was just making sure we
So
were,
it's
I was following the conversation.
But they wanted 873, right?
Right. Well,
Okay.
the first question I have is, I remember during last year's budget cycle, I thought we'd approved maybe like a part-time health inspector for the restaurants and positions. For some
You
reason,
approved a part-time to go full-time.
a part-time to go full-time, okay. And then the individual that retired and you haven't filled that position, then you're in turn going to end up with 2 new health inspectors if we allocate money for a new position as well, correct?
No, we didn't fill the position because we didn't have the money to fill the position. So when the person retired, we didn't
You just-
replace the position. So what we're asking now is the person that we lost 2 years ago. that
Okay.
we-
So you just absorb that money
Yeah, I mean, when you,
into you?
the main point I don't think that this Board of Commissioners grasp about how we're funded is that $250,000 is a drop in the bucket for a major department each year
Right.
to get at the size we are in a county like Cabarrus compared to someone who's a health department in a county like us anywhere else in North Carolina. $250,000 is a real bargain for, you pay that just in group health insurance, salary increases, before you even blinked an eye at a
Right.
department.
Well, I'm not arguing that. I
Yeah,
just,
so-
I was just reverting back to, I remember last year, something about health inspector, so
Yeah.
that's why I wanted to ask.
Yeah,
And then
it's-
I wanted to ask about that, somebody retiring, not filling a position if it was still vacant. for
No,
you
it's
to-
it's vacant because we wouldn't have the money to fill it, so.
Okay.
Madam Chair. I have a real concern with the environmental health inspector. As you know, I'm in long-term care. My facility is not being inspected as often as it should be. And I know there's a lot of long-term care retirement centers and nursing homes out there that are not being inspected properly. And we have our senior citizens, which is the most vulnerable, not being protected by the environmental health. I welcome when the inspectors come to my facility to ensure that my residents are getting the very best care they can. Everyone knows what Medicaid's doing right now. Medicaid cuts are hurting everyone. And when you have cuts, people take the opportunity to take shortcuts. And I would not want to see that happen in the environmental health. So please pay very close attention to the environmental health inspection. If you go to eat at a restaurant, it's getting to be a real serious situation even eating some of the restaurants. And that comes right back to us if we don't have the proper staff to ensure your safety along with your seniors' safety. That is critical.
And what you're saying is that the
Environmental
recommendation
health
is to
inspector
fund
is
that
included,
position?
yes.
Okay.
So is that going to get the one that we lost?
That still
Well,
leaves us too short.
Too short.
But we didn't cut the funding for the other one. You chose to move that money somewhere else, right?
To keep up.
Well, I understand, but we didn't cut the funding there.
You didn't cut the funding,
Okay.
but you also didn't provide any additional. You cut our funding, actually, the last 3 years, we've received less money
was in the
than we would have over the per capita funding. So,
Okay, dollar amount funding, total dollar amount funding,
has gone down over what it would have been if we had
not
stuck.
based on per capita.
If we had stuck with the per capita, that-
Not based on the per capita, just based on the amount of money that we actually fund.
yes, you funded additional money, but not in
Not in relationship to the population growth, I get
No,
that.
it's-
But I don't want it to go out and say that we have decreased the amount of funding you have. I understand there's different needs based on the increased population. I understand that one, but your overall dollar amount that we funded has not decreased.
no, the overall dollar amount has not.
I just
decreased.
wanted to clarify, because I know
That's
that
correct.
somebody's going to pick up on that and say that we've cut the budget. We had a long discussion yesterday on school nurses, if we take it out of the school's budget, which we've done, then are they going to say we've decreased funding to them? Technically, you could say yes, but in reality, we moved it to you guys where it should be and not be a pass-through so that we can better account for it.
That's
So,
correct.
The other thing that we're funding, which I agree 100%, because this was my big issue, is to make sure they did get health care coverage. I'll be honest with you. I know you and I had a conversation. I am shocked that only 8 people, as much as I got beat up over it, that only 8 people said they really wanted it. But I'm glad to know that it is an option for them.
But that key number 8 is about what we lose each year, so that's.
Right. No,
good.
I mean, and I think it's great that we're doing it.
Yeah.
We have had
Um,
many comments from the nurses that stated how much they appreciated that, and knowing that if something catastrophic happened to their family during the year, that at least it's an option that they could at least apply for it. So if
And
a
I think-
qualifying event came about, so they find the morale for that staff alone has changed tremendously since we made the announcement.
And I was surprised it was 8, with there being that many numbers, that many, 42 school nurses, but I'm glad that there's 8 people who are going to be able to take advantage of it. And I think that especially nurses that are going to be out there, if there is a smallpox or something of that nature, you're calling them into duty. And we should make sure that those people have coverage when they're being called into duty. You're not going to call me into duty for that, but you're going to call them into duty.
Don't know. Could be.
I can assure you that I don't know how to give a shot, so I'm not going to be the one telling
We can-
somebody
We can
to-
teach you.
Okay. What are the duties of the lead nurse? You need a lead nurse. You have 2 people who are supervising the 42 nurses.
The lead nurse.
So what are they going to do with the lead nurse?
The lead
that's not
nurse,
in
what
school?
happens right now is that with 42 nurses, there's hardly a week that passes that somebody isn't ill. So either Kim or Alice have to go work in that school because it is an important job, so somebody has to be in, you know this from your school. Somebody has to be there. So they end up there doing that job. We have nobody to do that now, so if Alice or Kim go do that, nobody's there to do their job. So the lead nurse would spell those nurses who are out for illness, family situations, other reasons, while they're out of there. In addition, they would provide that level of supervision. When you're looking at a level of supervision of the range of the things they do, 22 nurses per one person is a lot of responsibility, especially in the fact that they're in 22 different locations. So we would spread that over 3 nurses instead of 2. So it would become a more manageable number to get out. Alice and Kim said they rarely can get to all the schools in a year and visit all the nurses one time because it's just too much work to be done. So it would give us a narrow range of span of control of supervision and allow us to have more contact with what's going on in the schools. Because there are problems. Things pop up, parents become disgruntled, school staff are dissatisfied with something, but somebody has to be there and try to arbitrate what's going on, and we just don't have the time to get out there and do that now.
I understand. I just want to make sure I understood what the duties were going to be.
Yeah.
So
Basically, a jack of all
those 3
trades.
then are going to be, they're kind of going to be, instead of a lead nurse, are the 3 of them going to be co-supervisors, and maybe are you going to do like a regional geographic or theater zone?
Yeah.
You're over these and you're over these so that they could concentrate
Get to them
on-
quicker.
Yeah, get to them quicker and be on
Yes.
a certain part of the county. That seems to make sense to me as I'm thinking through it.
Yeah, it's like we do our environmental health inspectors. What we do is allocate them out by regions of the county so they get to places faster.
When you get inspected, do you pay a fee?
You can't.
Chris has said that he has to pay.
He has to pay to the state, but say
to
they don't give
state.
us the
That's
money.
right, you don't get the money. No, you don't pay a fee to the state. You're not required to pay a fee.
No, the state law says
sorry,
that
my
we can't
microphone's on.
charge. So, but he pays a fee and we get nothing back. So
But y'all do the inspection.
we do the
Yeah,
inspection.
we've argued that one for a while. It doesn't make too much sense. We heard
Do
from
the
Rowan
work and they
Cabarrus,
get
and I was
paid.
amazed how much of their tuition goes to the general fund. It
Well,
doesn't
and
do anything for community colleges.
For the record, all of our restaurants are inspected on time, regularly. And that's the truth.
Maybe maybe you hit the top of the list to make sure they can say that for
That's
you.
right.
so.
We're running right now in the neighborhood of 89 to 92%. And, for example, Mecklenburg's probably running 70%, 65, and that's the direction. It's just, it's difficult to keep up with the budget situations that all of us face around the state. So it's really difficult to find the funds to pay for environmental health. And the state gives each county health department, regardless of size, $5,000 a year to do this. 4,000 to cut it, excuse me. So we get $4,000 to do this with. That's not a lot of money.
with an environmental health expense of $785,000.
Exactly.
You get 4 from, it's nice.
Just for general knowledge, that is one of the goals of this board, is to solicit that from our legislators, to allow that funding to come back into the county, and every time we have an opportunity to talk to them, we bring that back up again. It still hadn't changed, but we continue to do that.
We get more response from the wall over here.
I would advocate for no fees.
For what?
For no fees.
Well, I would
Or
tell you,
at least keep them here.
it gets even more ridiculous when a new restaurant comes into the county, we have to review the plans.
That's
You know
another,
this, Chris.
that's another part of our goal request, is to
But
change that.
they keep the money. We review the plans, they pay the state, make us review the plans, they keep all the money.
That's another one of our goal requests, as well as another goal request is allow the Health Alliance to charge a fee that basically is what the user is willing to pay for the services that are received by the, not that they have to pay it, but if they choose to pay X number of dollars, they can pay it. We've asked for that goal for 3 years now. And again, that wall is more responsive to us than those who we're talking
Would that be on a volunteer
to.
basis?
Sir?
Would that be on a volunteer basis? Okay, enough said.
Well, we've been told previously that you have some folks who said, I'd be willing to pay you,
Yeah.
but you have to just flat out say we can't take it. And
That's
that,
correct.
that just doesn't make a whole lot of sense. So.
I can give you an
Commissioner-
address they can come to.
Pardon?
No. No.
No, we've actually had the federal government come in and tell us that we were doing that and we were doing it illegally because people wanted to contribute to our, so we set up a 501c3 so they can actually give to that now legally. But if someone is in our clinic and they've certified as zero pay and they wanted to give us which happens, I've got $100 I want to pay for my service, we can't take it because they certified zero pay. And if we do, yes.
Commissioner White, I know you are our representative
Mm-hmm.
to the board. You know a whole lot more about their budget, their discussions, and everything else, so
Well, you know,
I'll give you an opportunity to enlighten us all.
You know, Dr. Pilkington and Tammy and Mr. Kincaid do a tremendous job in regards to the Health Alliance. It is an invaluable service that is provided to this county. It may not go to each person in this county, but indirectly, each person in this county benefits. And what I have championed in the past, and I will continue to champion until my last dying breath, is it is absolutely ridiculous that we have what is called a not-for-profit health organization in Cabarrus County making $23 million plus each year on the residents of Cabarrus County, and not a dime goes to the Health Alliance. What's even more offensive is that just last year alone, that entity received a sales tax rebate from this county in excess of $1 million. They did not choose to use any of that money to assist the Health Alliance. And as a result, their emergency rooms and their doctor's clinics are going to get inundated by 300 prenatal patients at a minimum and 1,500 children. That is the sad state of affairs that we're in regards to that. Then you look, and that's just one organization. The other organization got just under $1 million. That is a health organization that's located in Cabarrus County. And then you got NASCAR. NASCAR, one organization received $483,000 rebate. The other one received $293,000 for a total of $776,000 rebate.
On sales tax?
Yes, sir.
NASCAR?
Yes, sir.
That would be those special legislation you referred to earlier.
So so what we're talking about is just talking about health industries. My concern is that they receive a tremendous amount of benefit because of all of the services that the Health Alliance gives, and they're able to make a profit, or excuse me, what they call revenue over expenditures. They're able to make that and not see fit to assist the Health Alliance. And they know the dire financial straits that the Health Alliance is in. It's not as though they haven't seen it. They have seen it, they know it firsthand, and they do nothing about it. To me, that's callous. So, and in trying to, and I know that Dr. Pilkington has tried his darndest to have carry-on conversations with those nonprofits, to health departments, to assist, and my words are, again, that wall is more responsive than they are, which is a shame. Those entities, those doctors, those medical professionals that are out there to help us and work with us turn their backs on us.
Based on
So-
their budget,
Huh?
based on their request and based on,
I would strongly
sorry,
urge
Lou.
us, if we can find that $550,913, if my math is correct, Mr. Parth, if we can find that, I would like for us to see what we can do about covering that for this year.
I'll second that.
you don't have a vote.
All in favor?
Wrong board.
Oh,
But it was a good
okay.
try.
Wrong guy.
That's just a habit.
Good try,
kicks
though.
in, right?
Chris asked us to
Made
speed
me
it up, so we were
excited.
trying.
Got me excited.
Either you have
I
any,
don't have no problem with that.
any specific questions that you want answered. I mean, we're going to have time for some general conversation among ourselves and to cover the things that we brought up yesterday and get that all together for us for Monday. But any other questions for?
Yes.
Yes.
Dr. Pilkington, is any of that you're asking, the additional money, is any of that one-time money, or is it all recurring?
It's pretty much all recurring, isn't it?
It is.
It's all
I mean, it's
recurring.
expense we're absorbing right now. If we don't get this, we'll dip into our reserve. That's what we'll have to do.
Okay, thanks.
Because we have no choice. It's existing expense.
Well, needless to say, one-time money is easier for us because we can, we can commit to that, and we know we have some funds available for that. It's the recurring part that hits the budget in perpetuity that causes us a little bit more, I won't say problematic, because that's not quite right word, but
Well, it can be negotiated. If it can only be one time, it would help this year, so.
Let's just get through this year.
Yes.
When I think,
Yes.
and the one thing that really has hurt is, here's a prime example. Medicaid reimbursement was supposed to be reimbursed at a rate of $2 million. The state of North Carolina was kind enough to say, you know what, we're just giving you $1 million.
Yeah, exactly.
So-
We lost $1 million.
And we just found out.
Yeah,
Like-
it's not, it's just absolutely.
That was to pay for the year we're in now. We found out now for the year we're almost finished with.
Yeah,
So-
the payments are 18 months past due.
That's correct.
well, it's kind of like we talked about the QSCB money. We agreed to
Mhm.
certain requirements, and then they changed their mind. That was federal government, but then they changed their mind.
Yeah.
And we've gotten hit with that with sequestration. Commissioner Meismer, I know you want to say something else?
No, I just was going to say, in full support of the increase in the hours for the school nurses and the insurance, and I know that's something we talked about last year, and I know that's included in the proposed budget from the county management, and as well as the health inspector position. So I'm inclined just to support the increase that the county staff has proposed.
And county staff did not propose increase in hours for the
Oh, they
nurses.
didn't?
They proposed an increase in an
just-
hour.
The days.
They
The days.
proposed
The
an
days.
increase in the days.
Just the days. I
So
see.
it wasn't that full amount. So are you saying that you
Okay.
support an increase in the hour?
Now, wait a
for
minute,
the-
explain the days was going from 90
From
something
196 to 205.
to 205, okay.
Yeah, the
But
school
it would
year-
still be 6,
6.5.
okay.
The instructional day number is to be extended.
Well, that's fine, because then if they're
So
getting the
that was
insurance for
covered.
50%, that's 50% cost. So just the days then.
Unfortunately, the additional hour that we had requested, there's no coverage for the children
Right.
when the nurse is not
Yeah.
there. And
Unless-
most of the
unless they
time,
stay
it's-
on their own
The point is
time.
that most of the
Those
nurses
hours
show
are
up and they're
important.
there that whole
Right.
7.5 hours.
I've gotten
They don't leave for lunch. They're there the whole 7.5 hours. And I think your point was they're getting paid for 6.5, but most of them are there for 7.5, maybe 8, to
Well,
cover when the kids are there all day long.
One thing, I've had several school nurses really complain that there's so much paperwork involved that they can't really do what they're supposed to do. So I don't know if that comes from your directives, or your departments, or from the state, or.
Of course, it's required at the state level.
Okay. I've heard that numerous of times.
And that's one of the reasons why if we could even give them any extra time, it would allow them to have more student time because, unfortunately, because we do get money from the state has requirements of what we have to report.
Right.
Well, and they serve not just the students in the school, they serve the staff too. If the staff is sick, they'll come down and, they'll tell them, I think you need to go home, or, it's probably not so bad, or in one case I know of, you really need to call the orthopedist because I think you've broken something. And that was a staff member who was sitting there with a bag of ice on the ankle, on the knee, propped up, dripping because there was too much work to be done.
Right.
And the school nurse said, that's not going to cut it. You're not going to wait this one out till the end of the school year. So they do
Right.
they do serve both the students and the
Right.
staff, so
And
most of their campuses.
And I-
They're also very limited on what service they can provide, or what medications, I guess. They can't even give
They can-
Tylenol, or.
Well, no, they can give the medications if the student has a prescription for them.
Right, but other than that, if I go down to the nurse's office because I have a fever, they're not going to give you anything, correct?
Unless they have a prescription for it, and that's not our decision, that's a
Right.
medical practice. But, one of the things you can feel really good about, because, I've told you folks before, we're one of the few counties that have a nurse in every school, even if it's only 6.5 hours a day. And they really do important things. We had a nurse within, and I think I related the story last year, within 1 week, she saved 2 lives. There was a teacher who cardiaced at her desk, over on her head. And we had a defib there. She went and got the defibrillator, defibbed her, had her back in a second, till EMS got there, got her to the care, and she survived fine and everything. And then 2 days later, she had a child choking. It was turning completely blue when she got called to the classroom, and she performed the Heimlich and got the object removed from the throat. But, that's what this nurse said was, I sure hope I don't have another week like this. But it can happen, but it's nice to have someone there with that medical expertise when it does happen.
And a lot of these children are on a lot of medication,
Yes.
and the nurse should not be responsible to be a teacher and a nurse.
Well, typically what happens when the nurse is not there, it's the secretary at the
Yeah.
front desk who's checking in people and, everything else that person does who does way too many things too. But, I know I've seen hours when the walkie-talkie goes off, she is running upstairs, and she's screaming for somebody else to bring the wheelchair behind her because she's not waiting on pushing the wheelchair or the elevator. She just takes off running, and there's some backup on campus, but nonetheless, when she's not there, everybody in that building knows that she's not there, just because somebody else is going to deal with it. So, and school nurses, to go back to where your funding's being cut, I hate to say it, but it is a reality. School nurses do a lot of prenatal care. Sadly, we have a lot of high school students that are pregnant, and that's who they go to first. They've gone to her for other things, and they go down there, and and then that's the person who starts talking to them about what you need to do. And if I don't know, folic acid is one thing that was an issue for my daughter with the club she was in, and we do that a bunch at my school. By the time you realize you're pregnant, it's too late to take folic acid to make sure that you don't have spinal bifida problems. So school nurses are out there telling those students, if there's a chance, you need to go ahead and do this. And they're giving a lot of counseling to students that I don't know that everybody notices. I know that's why they're needed at the high school level. A lot of those students don't have insurance, and that nurse is really providing that frontline care that, they're not going to now be getting from you. I hope you print a map out that when they come in, you can give them map and directions to
So those
find
hours are
the
very
care at
important.
another facility. So,
Yes, we'll be
for
doing
what
that.
you're
We've
not
already
gonna
got the
be.
letters ready and all those things done.
Because I think that's sad too, the cut. So, anything else of these guys? All right. Thank you very much.
You asked if we were doing anything you wanted to know
Yes,
about.
please tell us any exciting news.
Some tickets for any of you who would like for tomorrow night's Intimidators game. There's a 61-year-old phenom throwing out the first pitch.
Oh.
40-mile-per-hour fastball at best. I just letting you know that. And so you're all welcome. And if you need
Or
more
vitals
tickets.
Does he have the legs or the knees for it? That would be
Not the
the question.
knees,
Yeah.
but.
So
And
you're
one of
gonna run
our
the
s-
bases too?
One of our school nurses is singing the anthem.
Yes.
Are vitals being given to this gentleman before?
Well.
Do we have a defibrillator out there?
What's
at
that
the
nurse?
town?
We'll take one.
We need it. But if you need any extra tickets, we have several hundred. So,
Yeah, yeah.
Thank you very much.
We appreciate
Thank you all very much.
Oh, we did not purchase those tickets. They were given to us.
Yes, they were good to us.
It does say comp on here, so we're good. Okay, Commissioners, you have been handed the budget changes from our discussion from yesterday. Ann, do you want to go over those, Mike, or is there any information you want to give us about these?
Just one that got.
Your pleasure.
Okay, the first one there is the result of moving the school nurses out of the school system. So to adjust that ADM or per pupil, that would result in an additional $31,690 to go to the city of Napa schools. Right now, we're still going into their technology budgets. That's okay. We got that in details. There was discussion last night of potentially funding the requested growth for both school systems. Annapolis, that would be $158,590.
Just take the
And for the county system, it would be $1.2 million. Right now, for Special Olympics, $699. That would may change. That does not include the potential to pay the other so the economic development, that 20,000, that's not additional money. What happened was, due to the way we funded it last year, the 50,000 of that money was in consultants, and it was on mistake, so we're putting that back into the total, still at 312. The position, the social worker position that we were referring to earlier, that was located and half funded by the Health Alliance. It was actually located there. It is a benefit to the health department as well as our social workers in general. They could no longer fund their portion of it, so we were proposing to pick that up or put it back in there. So again, it was removed. And then the health insurance for our 3 part-time employees that we had originally had in the budget to begin next year would bring it back into this current year. If you support all of those as a group, again, these were just talked about as potential. Your contingency would have an impact or a reduction of $1,462,791. Therefore, we're just asking for some direction there on that.
Okay, and then Commissioner White, today you said that you would like to find some additional funds for the Health Alliance?
We'll go back and rattle the bushes and see.
I mean, that's what I'm saying, is just kind of look at it and see if that's something that we can get done in regards to Health Alliance.
Is the contingency, the 1.4 million, is that a reduction?
That's
Yeah,
the
you had
reduction to
1
the
Because it was
contingency.
1.8.
Right, so you're reducing that to pay for these.
For these
other
items, I
Yes,
see.
sir. Yep, so
And we normally would keep somewhere around 300,000 to 400,000 in that line item?
It
So
just
during the year,
depends.
we would,
Whatever you would feel
Right.
comfortable
Have
with.
something.
We were recommending probably 300,000. There's an additional 350 still remaining in there as well to cover any raises that the state may offer for schools.
It's
So-
326, 292 for the.
So there is potential, if that doesn't come through, then there would be an additional, whatever that number, 300 and some thousand.
or any adjustments to these. These were just ones that
Right.
we all talked about, so you kind of gave us everything that we mentioned yesterday.
Yes, ma'am.
And we need to make a decision on, not tonight, on how, any changes we want, so. You getting ready to say something?
Some of these, what we had planned to do at your work session on Monday After you go through your regular agenda, we would continue as another budget workshop. And based on what you tell us on these, the ones that you are ready to commit to, we will go ahead and adjust the 5-year plan to show you how that pans out that evening. If it's all of them, we'll put them all in there. If it's not all of them, then we'll put the ones that we know that you feel comfortable with, and then we'll run that 5-year plan for you so that you can continue to see what the progress is.
And if any monies are identified for the Health Alliance, it needs to be one-time monies. It's
Okay.
one-time, it is being designated
help
as
through.
one-time monies.
Okay.
And the reason why is that they, with that Medicaid, getting just slammed on Medicaid, it was a $1 million, they were told to count on $2 million, and they got one. So I think if they
Right.
if they had that, it would be a different conversation. So
Okay.
I just say one-time monies on that.
Right.
Well, and I agree with you. I think we need to look to help them out where we can. I think the social worker position, it makes sense. So Special Olympics, EDC are just correcting some, not errors, but just numbers that were in the pot. We talked about fixing that for Kannapolis on the school nurses. The health and, let's see, personally, I still think we should do the health insurance for those 3 part-time employees. What do you think? Anybody have any comments on the growth, the number of students for growth that you want to look at? You want to leave in those 2 amounts? You want to make an adjustment? I'm just trying to get some direction. If
Yeah.
they're going to redo the 5-year
I-
plan, what do you want done?
And that is, the growth for the school is taking their projected growth in students and applying the per pupil.
771.
771, is that what you used?
Thought was 9.
Well, they asked for 771.
Right.
That took
Right.
the apples out, didn't it?
This number is a result of Pam calling Kelly and negotiating, but I think she did the 771.
I believe it is
What's the
times-
negotiation
But
when
their
we said
number was 1579, so I think it was, and then some adjustment to that, so,
So that was figured without the school nurses, correct?
What's that?
correct.
Okay.
Correct.
The new growth, okay. Let me make sure.
Correct, correct. And then it was kind of tweaked.
Yeah, and
So-
as a result, in putting that amount to Cabarrus, the
Yeah.
result is, the proportionate result to the Kannapolis City Schools is a little higher than what their growth is
Mhm.
requiring, but so it will give them a little extra.
In regards to the city schools, if memory serves me correctly, the concerns that I have is it seems as though you get more coverage by having TAs and not teachers, so that if there is a way to designate any of this money going to TAs, because they were asking for 20 additional teachers, which ends up being 50 TAs.
Yeah, but we're not funding those 20 teachers.
Okay, well,
I agree with you, but we
Okay.
didn't fund those.
that I did not feel comfortable in. I didn't understand, I didn't get a good justification for the additional 20 teachers. And I think the TAs are hugely important. I don't think, I've yet to see anybody talk about a 2.5% salary increase, so that it ought to be what we had talked about, 1.5%.
That's what we've put in there for the local funding side.
I'm trying to think of the other, the band equipment for middle schools? No.
Yeah, well, that's not included, is it?
Sir?
It's not included, correct?
They
Yeah.
got to have land, you know.
Well, I guess the only comment would be, when we fund growth, that goes towards their operating,
Budget.
yeah, I mean, whether they use it on,
Well, see, my
they
problem.
wouldn't use it on band equipment because that's capital. Now, whether they use it on
Well,
something
my
else,
concern is if they use it on band
That's our
equipment.
thing.
If they use it on band equipment, and then next year we get an expansion budget or a continuation budget, we're never going to know if they used it on band equipment.
Well, now, when you do the ordinance, it's very detailed.
I understand.
So if you have certain places you want me to put this in the ordinance,
Can we put in there not band equipment? I mean, because I've got parents over in my area where I live saying, My child can take year-round band, but they cannot take year-round sports. They don't have year-round PE. My child is not musically inclined. Why are they being forced to having that as an option instead of having an option of PE or band? So that's what I'm hearing from where I am.
I would say on that line that says regular instructional services, that's based on those numbers, that we need to, as individuals and as a board, we need to decide how much money to fund for that growth. Is it the same amount? The proposal from staff is not to fund the growth. So that's what those two are, is in essence funding the growth. So I just think that's another conversation that we need to have.
We didn't make a decision on that. What we did was fund them flat and left a large amount of money in your contingency so that you would have flexibility as to what you wanted to fund.
Okay. Well, we know that Commissioner White has said that he'd like to get some money to the Health Alliance, and if we look to put keep $400,000 in our contingency, unless that other 350 shows up that you mentioned, we don't have any money for the Health Alliance. That's my point, is that we just need to.
Yeah, sure.
And I think that's your point, too. We need to decide exactly how much money we want to put where, so.
Well, the school system, the projected 771 or 779, whatever it is that, I know we probably went over this yesterday, but I can't remember. How is that predicted? I mean, how do we know that they're going to be 700 and something students?
There's an algorithm that the state uses that, who knows what it actually says, that comes up with a number, and they said that that's what they project.
So we'll never really know. So next year, their
Well,
budget.
you do know once they
Ultimately.
start giving us the 20-day number and the 40-day number.
But then there's no way we can get the money back if it's only 40 students. Right. Okay,
Well,
that's the whole conversation we had
when-
yesterday.
That's what we had yesterday, when you say if it's under 100.
Because
that you would
700
do
students
something,
sound
so.
like a lot. But anyway, that's just my.
On the fire taxes, we
I'm
have,
okay
just want you to
with-
think about those. We have 3 requests
I'm
for
not
increases.
okay with Mount Pleasant right now. I want to think about it some more. I'm okay with Coldwater and Mount Mitchell.
I agree.
Commissioner Burge?
You don't want to give Mount Pleasant anything?
Well, he didn't say that.
Right now, I want to think about it some more. I just don't, I mean, if we're going to increase the tax rate, I want to make certain that there's an agreement that says in X number of months, or a year, or 2 years, that they're going to follow through where they're asking, because, like I said, we have a fire department that said they were going to do something, and they haven't done it.
We have Mr. Smith, and the two guys that are our fire guys, Steve and Bobby, are here. If you have any more questions for them, I think that there is the potential, or certainly your prerogative, to put something in that contract that would do that. So.
Well, eventually you're going to have to fund all of it because volunteerism is going to go away.
We hope that's a while.
Huh?
We hope that's a while. I agree with you, volunteerism's going down. It will be extremely expensive for the county to have a countywide fire department
That's the reason I said the
that
other day,
hits like this.
Let the city annex
So-
all of it.
That would be the great state of Mecklenburg. Okay, anything else that you want, any other direction for staff, so that when we
Arts
get here-
Council, I'm
Sorry.
strongly considering taking out the $26,000 contribution. And my numbers on that is, we're either contributing to the Arts Council either through lease, finances, monies and all that, $228,549 or $275,089. I think it's $275,89. And the way I come up with that number, Parth, is square footage is 11,635. I think the rent's $14 a square foot, so that's $162,890. There's $72,199 that is utilities, custodial.
All that other stuff. Yeah.
That plus the $26,000 gets you to $72,199 thereabouts. and then $40,000 that we give to the school system ends up being a $275,000 $275,089 assistance. And for the
Okay,
city.
so you would want to add to this sheet that we were just handed, your recommendation is to add a line of a deduct for that amount?
Right now. I mean,
For
I
right
wanna-
now?
yeah, I wanna
Oh,
think-
it's not set in stone
Yeah,
yet.
and that's not, I would like to talk about it some more and hear what others got to say, but all the benefits that they mentioned to us are the exact benefits that Concord gets.
Okay, so to update this, we're going to add that in. We're going to add in one-time amount. Well, we have different money. Is that the same money for one-time projects?
That'd be a different
That would be-
That's
conversation.
different.
That would be fund balance.
Okay,
That would be after our budget,
okay,
I mean, excuse me, after our audit, when we know what we got.
okay. Well, we need to figure out a way to show additional funding for the health lines on here or somewhere where it would
We
come
will.
from so that we
We'll
could.
figure it out.
Yeah, I know you will. So I'm just trying to
Yeah.
repeat. Anything else that you want to have changed and you need information on Monday?
So Arts Council, we're not making any changes now, we're going to wait for that discussion on Monday, okay?
No, she said put it on the list.
I want you to put it on this sheet.
Do you want to go ahead?
So it can be
Well, I want you to
discussed.
list it in here so that we'll know which things we're going to talk about.
Okay,
Okay, and,
Well-
well, but I was gonna try to make the 5-year plan match your list.
we will, but we'll put pending by that one.
Yes, but
Okay.
pending.
Put pending by that.
Well, all of these technically are, well,
The schools, I was talking about I forgot to say about the return on investment. Just the idea is it fully funded or is it percentage? In other words,
Right.
to do that. And then the lease versus the buying, I want to get more information on that to be able to have that conversation.
Yeah,
We sent those requests this morning.
And a lot of that would come from one-time funding as well.
Okay.
I agree with everything that's been said.
Uh-oh.
Well, let me rephrase that. My iPad, you guys have talked so long, my iPads went dead. Anyway, so well, I agree with most of everything that's said. The only issue I have is, like I said, which I mentioned with the Health Alliance, is making sure that if that additional funding is found, that it is just one time, but it's just the additional, so we know that the 200 and some odd thousand is reoccurring. Other than that, yeah, looks fine with me, with the additions and subtraction.
and my only comment on that would be, part of that funding is an extra hour for the school nurses. So you would be saying, we're going to discuss it Monday. School nurses would get an extra hour this year, but they would not be guaranteed an extra hour the next year. Okay, so maybe that's something that if we lean towards putting it in there, that would be one that we might want to say stays in there. Because we do fund that. They're not going to get that money from anywhere else.
We'll pull
So
that
we can-
particular number out so you can see what that one extra hour would be.
Right.
So we'll put a pending on that one as
Yeah.
well.
That'd be
so.
good, and Commissioner White may be able to touch on this, being liaison to that board, is how the Healthcare Reform Act will affect the Health Alliance next year. Is that, I don't know if it'll be drastic or, you know.
I will get that answer for you.
Okay.
I will not speak off the top of my head.
I know
about
it's
it.
lengthy, but, you know,
No answer
I
for it
think that would affect a lot of the funding, and
Yeah.
we may not know till next
I
year.
know that Dr. Pilkington came in and spoke to us some time ago about it, but, yeah.
And on that note, Commissioner Burge, would you like to make a motion for us to adjourn?
I'd be glad to. Second.
Have a motion and a second. All those in favor say aye. Aye. Any opposed? Thank you all very much. We are adjourned. We will see you Monday. Same place.